Good evening and welcome to yet another episode of Focus on Health. I'm your host Yvonne Kimuma, and as always it's a pleasure having you on the show. Today is more about matters caring for your breasts, and we are joined by Dr. Mohammed to explore this wide topic, so stay tuned. Let's begin with the health update.
Dr. Mohammed Ali Bilal. I'm a breast specialist and a cancer surgeon based at Kenyatta University Teaching, Referral and Research Hospital. Yes, we are here dealing with breast issues from benign to malignant cases.
What do we mean when we say comprehensive care for the breasts?
Okay, what we mean is we get all the services at the same point, from screening, diagnostic, treating surgical part, and also going to the oncological part, which is provision of the chemo, and what I mean is review from the clinical oncologists and the radiotherapy experts within. And also we do reconstruction at the same time, so also counseling and everything within same roof. So you get everything from diagnosis or screening aspect, and then once you have been diagnosed with the breast cancer, you get counseling within our center. You get treatment, either you go through chemo or surgery, and then after that, if there is a need of reconstruction, also we do at the same spot or we do it later on. So it means it's a full package within the same roof. If you talk about a healthy breast, is a breast that is normal and is something where there is no abnormal changes, because breast, there is several changes that occur in women from puberty, when they're young, puberty, throughout their life journey, when they're pregnant, there's changes, when they're growing up until they're becoming in the menopausal period, there's changes throughout. So it's a lifelong care throughout the entire part of a woman's life. So a healthy breast is when there is changes which are not abnormal, and normal breast changes that occur from puberty, or from the when you're growing up as a woman or a girl up to the time when you become a menopausal woman. So these are changes which are normal. So a normal breast is a breast which does not have abnormal changes, in short. Several changes that occur in women from puberty, when they're young, puberty, throughout their life journey, when they're pregnant, there's changes, when they're growing up until they're becoming in the menopausal period, there's changes throughout. So it's a lifelong care throughout the entire part of a woman's life. So a healthy breast is when there is changes which are not abnormal, and normal breast changes that occur from puberty, or from when you're growing up as a woman or a girl up to the time when you become a menopausal woman. There's nothing like to say that every woman will have symmetrical breast. It doesn't happen like that. Most of the cases, they differ from one breast to the other. So that's how it is. What is not normal? Okay, first of all, breast is very unique to every woman. They differ. And most of the cases, we can say that even from a same woman or a same girl, you find that the breasts are not, both breasts are not symmetrical, or cannot be the same in terms of shape. This might be bigger than the other one, or maybe around the nipple there's a bit slight changes from the other breast. So it's not like you have a copy passed off the same breast to the other breast. So it's not like you're going to have same type of breast in terms of everything from the look. So they differ, and it's unique. One woman will be different from the other one. It's like that. So what I'm trying to say is, with the issue of being big, it can happen and it can be normal to a woman. Although when it becomes asymptomatic, maybe it's having back pain, something like that, then such a woman needs to undergo a medical checkup and has to be treated for something which causes a symptom, which is maybe back pain or something like that. Then that one can be assisted in one way or the other. And so basically that's it. How to identify that the breast has an issue? Most of the cases is women present with a breast lump or any changes in the breast. Then when you find yourself a change that has been there, especially which we can say that maybe it has been persistent for 1 to 2 weeks or 2 weeks and above, then you have to seek medical advice and a medical expert to see you, to review and to know what it is. Most of the cases, if there is any changes from the breast, either if there is a mass, the lump, there is a breast lump, the skin changes, there is a nipple changes, either is retracted or the skin dimpling. As such, then you have to undergo some tests, clinical examination by the doctor or any health expert, and then after that you can go for, it depends on your age, you can go for the ultrasound or you can go for mammogram. So it depends patient to patient as per the age, and then sometimes you go up to the MRI. It depends on the situation. So from there now, once we see there's something, maybe there's like a lump or something suspicious or something worrisome, then we do a biopsy. We call it a triple assessment. That is when we meet, finally we say that this is something benign, this is something malignant. And not in all cases we do a biopsy. There are some cases in young women when radiologists say that, hey, this is benign purely, then we can just do a follow-up with a scan.
Are there now any predisposing factors that perhaps women and even men can look out for?
We pick a diagnosis of a cancer, then we have to sit down with the patient now how to break the news. So we have experts within our here. Then we discuss with the patient that this is the situation, you have this, we do some counseling, and then once the patient has understand the situation that she is in, and then from there now we start treatment. From there we usually have to know which type of the breast cancer is it, which stage, then we go for staging. Which type of breast cancer, we do something called immunohistochemistry to see which subtype of the breast cancer it is. There are some situations whereby because of the subtype or the stage might go for chemotherapy first, or some of the situations whereby might go for surgery and then chemo later. So it depends patient to patient, stage. Sometimes even some patients are omitted for, especially with the early breast cancer, and there's a favorable subtype, maybe omission of the chemotherapy. So it depends which case we're dealing with. And then after that, if it is surgery, we do surgery, then patient wait, and then later on go for chemo, and then sometime might need radio, then we'll receive radio. And situation whereby we do surgery, it might depend. If we're doing mastectomy with immediate reconstruction, sometimes we do breast conserving surgeries. Sometimes these are different modalities we have to discuss with the patient, because for us as a breast surgeon, we do different techniques, not only mastectomy. We have breast conserving surgery whereby we just do a lumpectomy and remove some few nodes, or sometimes we remove the level 1 and level 2 nodes, and then or sometimes we do a mastectomy with immediate breast reconstruction. There are new types of mastectomy that also, like skin sparing and other types, we can put even some implants immediately. So it depends. the type that it is feasible for the patient, and the patient is the will of the patient to undergo such a procedure.
Are there now any predisposing factors that perhaps women and even men can look out for?
So usually we can say that some factors which increase the risk for breast cancer. So there are some which you cannot control them. Like, let's say, being a woman, elderly woman. So you can't. These things are there. And let's say early menarche, you cannot control that. It is increasing the risk, but you cannot control it. Late menopause also same. You cannot control that. So these are some of the factors which you can't control. They are just with the patient, with the person who is having the risk of breast cancer. And there are some which you can be controlled, which I put in an easier way to understand, such as let's say cigarette smoking. It increases the risk. So if you decrease, you stop, or you don't smoke at all, your risk factor decrease. The same as alcohol intake or consumption, fatty diets, obesity, which if you do exercise, you decrease the BMI. It helps. Taking this high dose contraceptive tablets. So all these things which can be controlled, and then it can enable you to decrease the risk of having breast cancer. But some factors which, as I explained earlier, which you cannot control, like being a woman, elderly, early menarche, late menopausal, maybe having family history, genetic components, those things we can't. So these are risk factors. There are some which they cannot be controlled, some which can be controlled by a person to decrease the risk. Taking this high dose contraceptive tablets. So all these things which can be controlled, and then it can enable you to decrease the risk of having breast cancer. But some factors which, as I explained earlier, which you cannot control, like being a woman, elderly, early menarche, late menopausal, maybe having family history, genetic components, those things we can't. So these are risk factors. There are some which they cannot be controlled, some which can be controlled by a person to decrease the risk.
Now, apart from now just watching out for lumps in the breast, are there any other symptoms that women can watch out for?
So any changes that I said initially can be a sign of a breast disease, not a must to be a cancer. Let's say if there's a nipple discharge, you have to go and check. Not unless you're breastfeeding. Nipple discharge, just breastfeeding is normal. So, okay, if you're getting a nipple discharge, no matter the color, you have to go and check what is it. It might be a sign of a breast cancer or not. It might be even a sign of normal breast physiology. Okay, and then nipple changes. If there's like crusting, something like that, you have to go and do a checkup on that. It might be something, a sign of a breast cancer. If there is skin changes, you have to go and check. If there is skin dimpling, like it goes down, then you have to go and also do a checkup on that. Sometimes even you might find some swelling just at the axilla when the breast is normal. There's nothing at the breast. Also have to go and check on that. So basically, what I'm trying to say, anything that is not normal, it has to be checked. It might be just a benign thing which is not a cancerous, or it might be a cancerous.
With that, we will take our first break here on the show. Continue engaging with us on our socials at KUTV Kenya, at Kemuma_Monari, catch us on YouTube at KUTV Kenya. Let's take that break. Here's the Did You Know segment. And we are back. Thank you so much for keeping it focused on health. I'm your host, Yvonne Kimuma. Do engage with us and send us your queries, comments, and feedback on our socials at KUTV Kenya, at Kimuma_Monari. Let's continue.
The breast cancer can happen to even male patients. We have a very small percentage, which is around 1% or less. Male patients usually get breast cancer. In fact, I have one patient I'm going to operate next week. It's a male patient, and it's not like it's common, but it happens. So even male patient has to know that when they have an issue with the breast, any changes, they have to come for checkup. It is not a disease of only women. So even men has to understand that when they have changes with their breast, they have to come to the breast clinic and to do a checkup. Like a case scenario, like yesterday, I had two patients. I was like, it's rarely to see a breast patient in my clinic, male breast patients. So I was like having two. I said that okay. So most of the cases is either male boobs or it happened is breast. Yeah. So men has to know that if there is any changes to their breast, they have to come. There is small chances, but it happens, which is around 1%. So anything that happened to your breast, or you can refer to chest, you have to come and do a checkup with us. So it might be something else.
So are there any other diseases that affect men in the breast?
Yeah, there is like the male boobs.
Oh, yeah.
Usually some patients come with there is like loss of self-esteem, and then we have to do something so that they regain that self-esteem to have at least a flat chest. So it happened. There are some few patients usually come to our clinic with male boobs, and sometimes it happens. It's not known. The exact cause is unknown. Some of the cases just physiological. Usually we guide them, especially if it's a young kids during puberty. We tell them there's nothing to be worried. Or sometimes they use some drugs, which is we call it drug-induced gynecomastia. So in such a case, we just tell them we have to get the history properly, like if there's any medication they're using or steroid, something like that. So if there is anything, then we can say that there's something here, we are worried about this thing might be the cause of you to get these male boobs. Then we have to stop this and to see how we're going to be responding. Sometimes it disappears. So if it is still persistently and there's loss of self-esteem, then we can help them with surgery. So it happens. There are many, not only breast cancer. There is a very common thing that happens to many male patients when they come to the breast clinic is something called male boobs, and it's treatable here still at the same center, comprehensive breast center at KUTRRH.
Is insurance maybe able to cover most of these costs?
Yeah, it depends which type of insurance, but almost all insurance are covered here at KUTRRH. Even all the procedures that we do, most of the procedures, they're very costly outside. It might even cost around maybe $500,000 to more. It's very costly outside. But good enough here at KUTRRH, they are fully covered by SHA. Even the reconstruction aspect, they are fully covered by SHA. So good enough, all the conditions, provided you are a Kenyan and you are registered with the SHA, you will get the service at the breast care center. Yeah.
Okay, there are factors that would affect women when it comes to them now actually seeking medical attention.
So most of the cases is awareness. It's awareness. So if there's no awareness proper to our community, then it is the main big issue. Number two is stigma. You know, as an African culture, someone say that to go to a doctor just to show off your breast, something like that. And also after that, and then being diagnosed with breast cancer, the family will just regard like this is that and that. So stigma is one of the issue. Number one is awareness, stigma, and then also there's an issue of delayment in terms of getting the services to get to the appropriate doctor to pick the diagnosis is also an issue. Some patients usually move from one clinic to another. You have just infection, mastitis, and reality is having a breast cancer. So also that one needs to play a big role in, especially in getting women with advanced stage of breast cancer. And also is maybe the religious and cultural issues. Also it hinders religious. Some women say that I don't want to be checked my breast, I just want to go maybe this a male doctor, something like that. Also it, or sometimes even some religious aspects say that you're not allowed to show even your own breast to another, either male or female, whoever, you're not allowed. So it's also an issue. Also culture wise, some say that no, it's something like prohibited, so it become an issue. And also another thing is this alternative medicine, herbal medication. So someone say that I have a breast issue, there is some medication that certain place, the village, they provide and it disappear, so they end up using such medication until it is at a late stage. Another thing is transportation, or being staying in a far location. At the villages, they cannot be in a position, cannot afford to go to town for checkups, also can lead to such a scenario whereby patient present at a late stage. So those are the factors. There are many others, but those are the main factors which cause delayment in seeking medical advice. Anything that is related to cancer is essential. Either you do a mastectomy, or you do reconstruction immediately, or delayed reconstruction. So immediate or delayed reconstruction is essential to the patient. So it's something whereby is covered within the comprehensive care of the breast. The issue of and also reduction, if it causes a back pain, we call it therapeutic. The word therapeutic reduction mammoplasty. The reason is therapeutic is it means it is to treat. The main reason we are doing that breast reduction is to treat that issue, maybe back pain. Even some cases with a woman with a very big breast and is having a cancer, you can still do, it depends on location of the tumor and the size, still you can do therapeutic reduction mammoplasty, and this is very okay, and that is essential. It's not anymore about okay, in reality the patient is going to have a good boobs, at the same time you have treated the condition of a cancer, but it's still essential. So if you come to aesthetic is when you do something just to look good. They say lifting, reduction with no any symptoms, then there now is not anymore essential. That one is cosmetic or aesthetic. So anything that is related to cancer or is a symptomatic breast, if someone is having a big breast, macromastia, and is having a back pain, or someone is maybe is in the military, is getting issue during training, something like that, then that person deserve to undergo reduction mammoplasty for the sake of the pain that is undergoing, or also sometimes we have some cases not only they have pain and also self-esteem. So it's sometimes, and that is when it's categorized as essential. So any reconstruction of breast cancer, immediate, delayed, or when it is therapeutic reduction, these three things, they are all essential.
Okay. And it is a wrap. Thank you so much for joining us once again. It's been a smooth sail all the way, and I trust you have been able to learn. Until next time, same place. My name is Yvonne Kimuma. I leave you with the healthy you.